Welcome, everyone, to this year's State of the West Symposium. I'm Mark Duggan, the Trione Director of SIEPR, the Stanford Institute for Economic Policy Research, and the Wayne and Jody Cooperman Professor of Economics here at Stanford. And I'm absolutely delighted that SIEPR is partnering today with the Bill Lane Center for the American West on this event. And it's been really great to work with Bruce Cain and many others on continuing something that was started several years ago, 6 years ago, by the two directors who preceded us, John Chauvin, who preceded me, and David Kennedy, who preceded Bruce. We always try with this event to take on the biggest issues that are facing the West. Last year, we talked about water and energy, which I think were quite topical then. And today, we will be talking about healthcare and immigration, two topics that affect people not just here in the West, but throughout the US and in many other places. And we'll have these two issues seem likely to be very important here in the West in the coming months, especially with a new administration coming to office next month. There's quite a bit of uncertainty about what's going to be happening with the Affordable Care Act and with various immigration policies, especially those along the border with the US and Mexico. And today we're going to really be able to shine the light on those issues with some great perspectives from leading experts from academia, from industry, and elsewhere. We're also thrilled to be joined today by Gitan Da Silva, who is Alberta's senior representative to the United States. She will be our lunchtime keynote speaker. And Butch Otter, who is the governor of Idaho, is also here, and we'll be hearing his keynote during the dinner. I'm very much looking forward to hearing their insights and the insights from everyone participating in today's events and from the questions and discussion that follow each of the sessions. And with that, I'm very pleased to turn things over to Bruce Cain, the Spence and Cleone Eccles Family Director of the Bill Lane Center. And I'll stop there. I got a lot of stuff.
Yes. Thank you very much, Mark. I'm just going to add a few points to this, and that is to say that, first of all, we are also at the Bill Lane Center very pleased to be working with SIEPR on this sixth State of the West conference. And as Mark said, the notion here is that there is a perspective which is unique that comes from the West about everything from land management to immigration to healthcare, perhaps, and that there are many forums that allow that Western expression of what's going on nationally and within our region to really come together every year. So we're pleased to co-sponsor this with SIEPR. We also, in this vein, have a Rural West Conference that we do every spring. And we rotate that Rural West Conference around to different states in the West so that we get out of the Stanford bubble and come to see some of the problems with the economy and healthcare that were highlighted by this last election. Many of you know that the rural-urban divide was a major factor in the way the voting patterns turned out this year. And many of the problems that were discussed by commentators after the election are problems that we were picking up as we went around and visited these various states. So it is our belief that Stanford can make a contribution to these problems, and we're thinking about how to do that. Let me also say, as a political scientist, that you might think we actually knew what we were doing when we picked these two topics. But of course, like the rest of the world, we had no idea that we would have such a dramatic political change. But clearly, you can't imagine two topics that are going to affect the West more than both the healthcare and the immigration policy, and that the changes that we're beginning to see are going to be quite dramatic. With respect to healthcare, for example, California expanded healthcare into through Medicaid rather, into a larger program of Medi-Cal. If that program is modified in various ways, it could mean that the state has to make hard choices about whether to continue that coverage or pay for it. And with respect to immigration, between the H-1B visa and the large number of undocumented we have, clearly the choices that are made in DC are going to have a major effect on the West and on California. So we're really pleased that we picked these two topics, and we think that the discussion today is going to be very important as we think about the next couple months in the policy making that's going to occur in DC. So with that, I think we can get started with our program, and that will start with John Chauvin and introducing our luncheon speaker. Thank you.